I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. At ThedaCare, we're dedicated to providing exceptional close-to-home care, and we're thrilled to continue to increase our footprint and the positive impact we can provide. And that includes expanding into the greater Fond du Lac area. We're excited to announce the opening of ThedaCare Medical Center Fond du Lac. Centrally located in the retail district near I-41, this modern community hospital offers around-the-clock access to high-quality, convenient care. In today's episode of Health Inspired Talk, we're giving you a sneak peek into the new medical center. To get started, Gina Neace, our Vice President of Medical Centers Fond du Lac and Oshkosh, is joining us today. Ginny, thank you for being with us.
Thank you for having me.
So we're hoping that you can take us on a behind-the-scenes tour of the new health campus.
I'd love to.
All right, let's get started. All right, Ginny, our first space is the emergency department, a really important part of this campus. Can you tell us a little bit about the space and the care that will be provided here?
Absolutely. Well, welcome. We are thrilled to have you. We have 8 rooms in which we're providing emergency care on this side of the facility. And really, our focus here is to ensure that we are providing the right care at the right time at the right place. So regardless of the care that you need, as part of an integrated delivery system, we are here to ensure that you get exactly what you need and deserve.
So 8 rooms here, and like you said, fully equipped to handle anything that's coming through our doors.
Absolutely. And it's through our partners as an integrated system that will ensure if you need a higher level of care that we get you that access as well.
How important is that to be able to offer that to the people of this community?
It's critically important. We know that demand for access continues to increase in the Fond du Lac community. And as a Wisconsin-led organization, we're committed to that. And so it's really ensuring that we can deliver on that for this community.
That's wonderful. All right, let's take a look at our next space.
Sounds great.
Our next space here is the nurses station. Can you describe this space and the design behind it?
Absolutely. It really is incredible space. And it was designed with input from our team members as well as our physicians, because they, at the end of the day, know what is best for our patients.
I noticed that you can see into all the patient rooms. Was that intentional?
Absolutely, very intentional. It allows our care team and our physicians to have line of sight and also allows collaboration in the care that they provide.
All right, important for our patients.
Absolutely.
All right, let's head to the next space.
Great.
Okay, this is the inpatient space. What are we using this area for?
Yes, so we are a fully licensed acute care hospital equipped to handle most medical needs. So whether you have back pain, migraine, chest pain, come to us and we will ensure that you get the care that you need.
And what if you need a higher level of care?
Yes, so one of the advantages that we have as an integrated delivery system is that we will meet your needs here if we are able to, and if not, we have access to our broader system to ensure that we are able to address your needs.
All right, that's wonderful. Let's go on to the next space.
Great.
Okay, so we are now in the specialty care area. What will take place here?
Yes, so we are excited to provide cardiology clinic services in this space when we open. And I think what's fantastic about this health campus is that we have the ability to expand and grow over time based on the needs of this community.
And that's really important. As we are an important part of this community, we're excited to be here.
Absolutely, we're thrilled.
All right, Jenny, thank you so much for taking us on the behind the scenes tour. We appreciate it.
Thanks for having me.
Dr. Nate Larsen is our medical director of the emergency department in Fond du Lac. Thank you so much for joining us.
Yeah, thanks for having me.
So before we get into the specifics about the emergency department at the campus, we want to know a little bit more about the community itself. We hear that you are a native of Fond du Lac. So what makes your community so special?
Well, there's all kinds of things to do in the community. It's close, it's a small town feel, but you're close to a lot of other big cities. So if you can't find what you want to do in Fond du Lac, it doesn't take that too long to get to Madison or Milwaukee or Appleton up the Fox Valley. But it's got 4 seasons. We like outdoor activities as far as biking and boating, and I've lived there for a long time. So I consider myself a native even though I wasn't born there.
And any hidden gems in the community that you want people to know about?
Yeah, it's the 4 seasons, right? So the fishing tournaments and the ice sculptures and the outdoor activities. So it's a different world when the lake freezes over and you can drive your car on the lake. So something that not everybody gets to experience.
Absolutely. So let's talk a little bit about the emergency department itself. We've been in there, we're seeing it now come to life. It's super convenient and it's comfortable. What was, the basis behind the development of that emergency department?
Well, as far as the location, it's number one. It's where everybody is at. So it's right off the freeway. It provides easy access into the campus, and it's obviously strategically located between Frederick and ThedaCare up in the Fox Valley. So even if we can't provide the care there, and it gives us a direct avenue north or south to give them to the next campus that they need to a higher level of care.
Can you talk a little bit about that? Because it's an entire fully staffed emergency department, and if people do need that next level of care, what are their options?
As far as options to get transferred, usually it's by ambulance. So we have ambulance services will be set up to be transferred, but you've got cardiology, you've got neurology, neurosurgery, up in Appleton and Neenah, and we're now integral part of Frederick. So we're now merged into one healthcare system. So we have that just down to the south in Milwaukee, which is just a hop, skip, and a jump away.
So how important is it for the patient who might need additional care options after they leave the emergency department?
Well, we have referral options for pretty much every specialty. So if we can't get them locally in Fond du Lac, obviously it's just the closest would be Appleton and Oshkosh. So we can get them referred into the specialist, but we'll have obviously primary care there in Fond du Lac as well to refer back to. So being able to just make those connections and getting the patients plugged into the community to the services they need if it's not emergent care.
In your years, you've been practicing medicine for a long time, seeing many, many changes. How has emergency medicine sort of evolved and become more comprehensive and really that personal connection?
Well, it's usually still the front door of the hospital system. So, we get to see patients at their worst. It's usually not a good time when they're coming to the emergency room. They're usually having the worst day of their life many times. And so, get to have that opportunity to interact with them and be able to help them through that process, and then help them get them transferred to higher level of care if need be, or be able to care a lot of primary care even through the ER stay and get them plugged back into the community. Again, the ER is just a piece of that component, but it's an integral piece of that component. So it's exciting to see a new facility and having ER close to my hometown or in my hometown. So
yeah, what have you heard from the people so far? Are they excited?
They're excited. Yeah, there's a lot of excitement, and when are you opening? When are you opening? They're wanting to know when they'll be able to start using our services there in Fond du Lac.
All right, Dr. Larsen, as we're looking ahead to the opening, what are you looking forward to most?
I think being able to just care for friends and family and acquaintances back in the emergency room, and being able to see them back in the community again. It's something about being able to walk out to the stores or restaurants and being recognized, and people are very grateful.
All right, Dr. Larsen, thanks so much for being with us, and we're looking forward to the opening.
Yeah, me as well. Thank you.
I'm joined by Gina Neace, our supervisor of radiology. Gina, thank you for being with us.
Thanks for having me.
So can you tell us a little bit about the imaging space that we have at the campus?
Yeah, currently we are in our radiology room, and then we have CT, ultrasound, echo, nuclear medicine, and we'll also be doing stress testing for cardiology.
And who can receive those types of services here?
So all of our inpatient, our ED patients, and then scheduled outpatients can come and have those services completed.
Okay. This is designed just a little bit differently than some of our other health campuses. Can you tell us a little bit about what's unique?
I think it's just keeping it close to home. It's easy in, easy out. Our services are all here and available for the patients right here in Fond du Lac.
Why is it important to have those services available? Well, how does it help ease the care for our patients?
Yeah, I think just because it's a smaller location, patients don't have to travel. They're not traveling to the big city, and just keeping it really close to their house.
Convenient.
Yeah.
Gina, thank you so much for being with us.
Yeah, thanks for having me.
We're excited to welcome you to ThedaCare Medical Center Fond du Lac very soon. Watch for more opportunities to meet the team members and learn about additional services. We'll see you next time. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.